Hello everyone. Today we are going to discuss Anatomy of Scalp Part 2. In Part 1, we have discussed the layers of the scalp and the applied aspects. Today we are going to discuss the blood supply, the nerve supply and the lymphatic drainage of the scalp. So let's begin with today's session. The nerve supply of the scalp. The scalp is supplied by 10 nerves. The sensory nerves of the scalp are from the fifth cranial nerve, which is the trigeminal nerve. So the trigeminal nerve via its three divisions, that is the ophthalmic division and the maxillary division and the mandibular division. So through these three divisions, the trigeminal nerve will give sensory supply to the scalp. Scalp is also supplied by the cervical plexus. Let's study them in detail. So as you all can see here, this is the nerve supply of the scalp. If you see here, there are almost 5 nerves in front of the ear, and that is why it is called as preauricular nerves. And there are 5 nerves behind the ear, and these are postauricular. So of the 5 nerves in front of the ear, 4 branches are sensory and 1 is motor, and the same applies behind the ear. We have 4 sensory branches and 1 motor branch. So let's study them in detail. The first nerve what we are seeing here is the supratrochlear nerve and the supraorbital nerve. Both these nerves are sensory. Let us see the branches from where they originate. So both the supratrochlear and the supraorbital. So if you see here, this is a supratrochlear nerve and this is the supraorbital nerve. Both of them are originating from the frontal nerve. So this frontal nerve is from the ophthalmic division of the trigeminal nerve, which is the fifth cranial nerve. Having discussed about the supratrochlear nerve and the supraorbital nerve, now we'll move on to the next nerve, that is the Zygomatico temporal nerve. So this nerve is the Zygomatico temporal nerve. This Zygomatico temporal nerve, which you can see it here, the Zygomatico temporal nerve is a branch of the zygomatic nerve, which in turn is from the maxillary division of the trigeminal nerve. Now next, having discussed about the supratrochlear, supraorbital, zygomatico-temporal nerve, all these 3 nerves are sensory nerve because it's supplied by trigeminal nerve. Now we are moving on to the 4th nerve, which is the temporal branch of facial nerve. This is motor, and let us see it is a branch of which nerve. As you can see here, this is a temporal branch of the facial nerve. Facial nerve is the 7th cranial nerve. Since it's motor, it is supplying the frontal belly of the occipital frontalis. So having discussed the supratrochlear, supraorbital, zygomatico-temporal and temporal branch of facial nerve, we now move on to the last nerve in front of the ear, which is the auriculotemporal nerve. This auriculotemporal nerve, what you're seeing here, that is a branch of mandibular division of trigeminal nerve. You can see here, this is the mandibular division of the trigeminal nerve. So we have discussed all the 5 nerves in front of the ear. So we have seen that supratrochlear nerve is sensory, supraorbital nerve is sensory, zygomatico-temporal nerve is sensory, auriculotemporal nerve is sensory. The motor branch is temporal branch of facial nerve, which supply the frontal belly of occipitofrontalis muscle. Now we move on to the nerves which are behind the ear. As already discussed, there are 5 nerves, out of which 4 are sensory and 1 is motor. So let's begin with the first nerve, which is the great auricular nerve. So the great auricular nerve, what you're seeing here, this is a great auricular nerve. So this is a branch from the cervical plexus. Again, this nerve is sensory. So the plexus of nerves you're seeing here, this is a sternocleidomastoid muscle emerging From the middle of the sternocleidomastoid, all these nerves what you are seeing here, they are the branches of the cervical plexus. So great auricular nerve is a branch of cervical plexus and it is sensory. It gives sensory supply to the scalp. Now we are discussing the next nerve, that is the posterior auricular branch of the facial nerve. This is motor. So what you are seeing here, that's the facial nerve, which is the seventh cranial nerve. This is a posterior auricular branch of the facial nerve and this supplies the occipital belly of occipitofrontalis muscle, and this is motor. So we have discussed about the great auricular nerve, which was sensory and it was from the cervical plexus. We have also discussed the posterior auricular branch of facial nerve, which is motor. Next, we are moving on to the lesser occipital, greater occipital and third occipital nerves. All these three nerves are sensory and these are branches of the cervical plexus. So we can see here, this is the third occipital nerve here, and this nerve what you're seeing here, that is the greater occipital nerve, and this nerve you're seeing here, that is the lesser occipital nerve. So with this we finish the nerve supply of the scalp. Now we move on to the blood supply. The scalp is supplied by both the internal and external carotid artery, which are the branch of common carotid artery. So you can see here, this is the common carotid artery. You can see here, this is the common carotid artery which divides into external carotid artery and the internal carotid artery. So the scalp is richly supplied by blood, which are blood vessels, which are branches of both the external carotid artery and the internal carotid artery. Now the blood vessels which supply the scalp they follow almost same name as that of the nerve. You can see here there is a supratrochlear artery. This is a supratrochlear artery and supraorbital artery. So these two, supratrochlear and supraorbital, they are the branch of ophthalmic artery, which in turn is a branch of internal carotid artery. Now we'll move on to the next. So in the next, the branches, namely we have the superficial temporal artery, which is a branch of external carotid artery, and then we have the posterior auricular artery. We'll be seeing them in the next slide. So blood supply as already discussed, we have the supratrochlear artery, supraorbital artery. Both these are the branches of internal carotid artery. Now we have superficial temporal artery, posterior auricular artery and occipital artery. All these are the branches of external carotid artery. So you can see here the superficial temporal artery, posterior auricular artery and occipital artery. These are the branches of external carotid artery. Whereas the supratrochlear and supraorbital, they were the branches of internal carotid artery. Having discussed about the blood supply, we now move on to the venous drainage of the scalp. So if you can see here, the supratrochlear vein and the supraorbital vein near the angle of the eye, median angle of the eye, they join to form angular vein. So they join to form the angular vein. The angular vein continues over the face as the facial vein. Now we have the superficial temporal vein and the maxillary vein. In the parotid gland, they join to form retromandibular vein. This retromandibular vein will divide into anterior division and the posterior division. The anterior division of the retromandibular vein will join with the facial vein and it will form common facial vein. This common facial vein will drain into internal jugular vein. Now we'll move on to the other aspect. The posterior division of the retromandibular vein will join with the posterior auricular vein and it will form the external jugular vein, which will drain into the subclavian vein. So this is the subclavian vein. So this is the venous drainage of the scalp. Now discussing about the lymphatic drainage. The part of the scalp which is anteriorly and in front of the ear will drain into preauricular lymph nodes, and the scalp posteriorly will drain into postauricular lymph nodes. So that was about today's topic, where we discussed the nerve supply, blood supply and the lymphatic drainage of the scalp. Please watch part 1 to have a complete picture of the scalp. Thank you so much for watching this video.